I hope that everybody enjoyed the workshops, and it seems like all the technology has helped us. It's nice that we have all this technology when COVID came around and not before we had all the technology. Welcome to the final part of the plenary program. Unfortunately, the timing of the program does not allow for a short recap on the workshops. So we'll just move on to the next part of the program with two companies, startup companies that are explaining their solutions, where AI plays a part of their role in healthcare. Bram, can I ask you to take the first one?
Yes. Yes. Thanks for having me. First of all, my name is Bram and Teuling. I'm one of the founders of Orikami, and yeah, this is a presentation from home. So yeah, good to see you all in this virtual world today. I would like to tell you today something about how digital biomarkers are accelerating personalized healthcare. And for the next slide. And for me, that started about 9 years ago when I started Orikami, because I was convinced that healthcare data can be used a lot smarter. While data is exploding, the use of data in clinical decision-making is just not keeping track. And maybe the best example to show this is when I spoke to Irene. Irene was having MS, multiple sclerosis, and she was having the disease already for about 15 years when I spoke to her. And she told me that for all she knew, she could be in a wheelchair the next day. Can you imagine? I was really shocked. If with all this data available and all the possibilities of new ways of transforming this data in relevant information, how can it be that she and her neurologist are so in the dark? So I start asking her, do you see any patterns then that you start recognizing by now? And she said, no, I see my neurologist 10 minutes every year. And she even told me that she stopped taking her medication because she didn't think it made any difference for her. And she lived every day uncertain what the next morning would bring. For example, about being in a wheelchair or not. And for us, this was unacceptable. We believed there was indeed a huge underutilization of data here. And when we dove deeper into this disease, we figured out there is data that is easily available, which is both prognostic and relevant in day-to-day settings. And while everybody nowadays has these high-quality sensors in their pocket, yeah, we can simply let patients monitor and measure themselves in their own home environment. And the reason this data is currently never used in clinical decision-making is because it lacks rigorous medical validation for these relevant healthcare decisions. And this is exactly the core business of Orikami. So we transform this data into validated, actionable information so we can take medical action on it. And that's what we call digital biomarkers. So the process from data to information which can be used in clinical decision making. And we really believe there is no escaping of digital biomarkers, and it will be the future of healthcare, making it possible to treat people based on their personal data. So let's take one step back. What is the real problem that we're solving here? And the problem behind this is the imprecision we have created in healthcare. Here on the left side, you see the controlled setting in which most of the interventions are, or healthcare interventions are based on. So evidence-based medicine, while very valuable, is suboptimal because all evidence is gathered on groups and not on individuals. And then it's written in protocols, also very helpful, but it doesn't say anything about this one person in front of you. What is the best way to treat this person that you're dealing with today? So if you look at Irene, she was using Copaxone, a medicine that by the time generated about $4 billion worldwide in revenue for the pharmaceutical company that created it. But a recent Nature study showed that this medicine is only effective for 1 in 16 people. So she was probably right to stop her medication against the advice of her neurologist. Because of this $4 billion, about $3.7 billion is wasted every year again, and is only creating the side effects of the treatment. And if you look at the top 10 highest grossing medicines worldwide, it's estimated that about 80% is waste. And digital biomarkers can and will help to do better in this process. So let me show you the simple intervention that we, or the invention, I should say, that we created for this. It's called MS Sherpa. It's a CE certified device which lets people monitor themselves at home when they have MS. And there are 2 important cases that we focus on with MS Sherpa. And one is the earlier and more optimal switch of MS medication. And the second one is safe stopping of MS medication. So, and then you see that MS isn't a really big disease in the Netherlands, and especially not the people that are on first-line medication where this is relevant for. But still the potential impact is very high. So you see that there's a potential cost saving of 6.5 million euros a year. And that while we also gain a better quality of life just by more optimal switching and safe stopping of medication in the Netherlands. So how does it look like? It's the biomarkers consist of simple tests on your smartphone. Here you see a small video of a walking test. You have those sensors. You put the phone in your pocket, by the way. Start walking for 2 minutes. This goes a little bit faster, but I think you understand how it works. And in the meantime, this is gathering data. This is gathering information about your gait and how you walk. And we use that to give feedback on indeed if the treatment is working. Same here with the cognition test. So what you see here in the top is a lookup table. The symbol in the middle, you have to combine that with the right number. This test is validated in multiple sclerosis and very relevant in detecting disease activity. So we use that and gather data on this disease activity and disease progression, which we use then in clinical decision making. And maybe so where did that bring us as a company? First of all, yes, we create these solutions, but where I'm most proud of is that we are able to bring together a unique array of experts in our organization. To create these kind of things, you need the medical expertise and the technical expertise and ways to communicate with the whole stakeholder landscape around it. And for us, that's an important part of what we've created in the last 9 years. Also, the work together with our partners, Amsterdam UMC and patients. Every 3 months, we had about 5 patients coming to our office when we were building this product for multiple sclerosis, for example. And what it also brought us is, and maybe the thing I truly underestimated in this journey is the complexity of the stakeholder landscape in healthcare. And I'm very happy that our hard work and investments are paying off and we are becoming an integral part of the ecosystem. And that's where I want to leave you with, because yeah, I hope to have shown you that healthcare is transforming and that digital biomarkers will have an important place in the healthcare ecosystem to personalize treatment. And our mission in that is to improve about 100 million lives in the next 10 years by personalizing healthcare.
Thank you, Bram. It's not possible at this moment to have questions with the audience, but maybe one small question. Does digital biomarkers, would that mean that almost everybody in the future will walk with a certain device that collects all kinds of digital information about ourselves?
I think that I think this will be the face of medicine and healthcare in the future. So you don't first go to your doctor. No, you try to solve as much as possible at home. You already do that. But the possibilities are indeed becoming more, and especially for people with chronic diseases, I think this will have a huge impact.
Yeah.
Every time going to a neurologist because it's just scheduled once a year as a standard protocol, I think we can do a lot better than that. Yeah.
Yeah, thank you.